Hi, my name is Jake Strelo, and this week I'll be talking about some of the articles and video that we focused on this week. And these sources really all portray to the relevance of stigma and perception when making choices, and especially healthcare related choices. The first article that I'll be talking about is titled "Can I Afford Free Treatment? Perceived Consequences of Healthcare Provider Choices Among People with Tuberculosis in Ho Chi Minh City, Vietnam." So, for the summary of this article, tuberculosis is often a major health issue in developing countries like Vietnam, and the disease has really been linked to poverty. And particularly, very close living conditions make the disease extremely lethal, as it can be spread from one person to the next very easily. In Vietnam, the government has issued a treatment care plan because of TB for people affected by this disease, and the program is called National TB Control Program. It has outstanding recovery results. 90% of patients are cured, and it's also free. Yet, private health sources make up 84% of the health expenditure in Vietnam, which shows that there's a good amount of private physicians being visited, even though the NTP government sponsored is actually free. So the question of the study was, what are the reasons for some people in Vietnam to opt for private healthcare providers and spend large amounts of money when effective TB treatment is available free of charge by the NTP program? So this study, some of the methods they used, they carried out in Vietnam's largest city, which is Ho Chi Minh. 3 TB treatment services were identified: the Public National TB Control Program, which is the NTP, private physicians, and an evening clinic where doctors worked overtime and charged patients on a fee-for-service rate. 26 people diagnosed with TB were interviewed for the study, and researchers asked the patients questions pertaining to their choice of provider and what they thought perceptions of the provider were. So some of the results of the study: most patients first thought their illness was a benign respiratory infection, and they thought they could get the quickest treatment by going to a private physician. So most of them went to a private physician right away. And once the subjects realized that they had TB, they had to decide if they wanted to stay at that private physician or switch over to the NTP or a different source of healthcare. They took advice from friends and relatives who had experienced similar things, and none of these patients mentioned anything negative about the NTP. So it would kind of be a no-brainer that they would all switch over to the NTP. But most patients responded saying that they thought they had a better chance of being cured with the NTP provider, but the privacy and convenience of the private physician outweighed the NTP. So the privacy of the private physician included physical privacy in their own room as well as social privacy. So the community isn't really going to be able to find out that you're infected with TB because you're kind of isolated. So perceptions towards the no cost of care at NTP were negative. Patients thought that since there's no money coming from them and going directly to the doctor, then the quality of care is going to be poorer. So some pertinent concepts about this article: people acknowledge positive aspects of both providers, but the choice often comes down to privacy and perceived quality of care. I personally think it's crazy how they base their opinions so heavily on perceptions and very little factual information. But if you have so many friends and relatives who unfortunately have been infected by the disease, you kind of learn to take their word for it, I suppose. So that was the first article, and the second article is titled "Cultural Concepts of Tuberculosis and Gender Among the General Population Without Tuberculosis in Rural Maharashtra, India." So a quick summary of this. The study focused on perceptions and stigmas related to different genders contracting TB. And some of the methods they used, they carried it out in the Pune district in western India. And something interesting that they used is the male researchers interviewed with the male patients, and the female researchers interviewed with the female people. So some results of this study. Males often reported losing their job and losing all income when people found out they had TB. Females try to hide TB more than men do because they're afraid of social isolation. And half of the respondents said that with TB get treated with less respect. So they think that it's kind of underestimated. And most respondents had confidence that the disease could be cured, while men were more confident that it would be cured than women. 2/3 recommended government health providers, while only 1/3 recommended private providers, whereas the last article showed that it was about 50-50 private and government NTP providers. So some pertinent concepts of this article is there are major differences between genders in terms of stigma when talking about disease. Therefore, it is important that epidemiologists compare gender disease patterns before making any overarching assumption about a disease. So this kind of makes me curious about the COVID-19 pandemic we're in right now. And are there a difference in infection rates between genders for that? And obviously there's stigma with the disease, as if you're infected, you could potentially lose your job, and no one really wants anything to do with you, so they don't get the disease. So that's some stigma that relates to also the TB epidemic. So the last source that I'm going to be talking about is the video Collateral Damage. A summary for this is U.S. military servicemen and their families live on a designated island in the Marshall Island chain. So just one island, and there's a chain of islands. So this island is similar to a neighborhood in the suburbs of the U.S. So there is a plethora of resources for these families. But the Marshallese are the people that keep this town running by doing all of the work to operate the stores and restaurants. So they come over on a boat, about half an hour ride every day, and they work in these stores that provide to the U.S. military servicemen and their families. But despite the Marshallese significance to this community, they live on a different poverty-stricken island where they don't have much access to health care, whereas the U.S. servicemen and their families have just a plethora of healthcare sources. So, and TB is a real problem amongst the Marshallese because it is a poverty-stricken island or chain of islands. They're in very tight living quarters, so that makes the spread of the infectious disease very high. So. Some of the Marshallese actually seeking a better future come to Springdale, Arkansas here in the U.S. because of the cheap cost of living and abundance of labor in food processing. But even though they come over to the U.S., they still can't escape the poverty that they have lived with their entire lives. So not much really changes, except they might not be as in as tight living quarters. So some pertinent concepts of this video that I thought is there's a real problem in our world pertaining to the extreme difference of being rich and poor. The rich can be so close, as we see in the Marshallese Islands, and still have hundreds of more resources and much better healthcare than the others. So it just blows my mind how the Marshallese can just be so significant and have so many less resources. So some similarities that I thought of between all these articles and the video is that they all portray, or actually the money plays a massive role in determining the type of healthcare one receives and the quality of healthcare. And I really don't think this is fair to everyone in the world. So I believe at some point in time there's going to have to be like a serious initiative to broaden the healthcare system globally. It is not. I don't think it's right that wealthy countries such as the U.S. are practically unaware of TB anymore. When it's just demolishing populations in developing countries like Vietnam and amongst the Marshallese. So, thank you.